Over 600 patients have recently been transported across various hospitals in the province from facilities overburdened by COVID. Between the transfers and field hospitals dedicated to COVID response, the system remains strained, and that is where the Cortellucci Vaughan Hospital comes into play. Before doors open to this brand new facility Sunday, I checked in to see how preparations are going.
They are ready, says Mary Agnes Wilson, Mackenzie Health's chief operating officer. 1,500 staff recruited for the brand new state-of-the-art Cortellucci Vaughan Hospital, a facility years in the making and days away from opening on February the 7th, but not as originally planned. Touted as Canada's first smart hospital featuring advanced technology and the first net new hospital Ontario has seen in 30 years, the only patients here will be those affected by COVID-19, at least for now.
In terms of our intensive care unit, it is a state-of-the-art intensive care unit. It's 35,000 square feet. There are 35 intensive care rooms. They're all single patient rooms. One of the sections in the intensive care area can be converted to an entire negative pressure zone, as well as each of the pods can have airborne isolation rooms in them.
On top of those critical care beds, an additional 150 beds will be available to help support non-critical patients from other GTA hospitals. The goal? To help alleviate hospital capacity pressures caused by the pandemic. The first day, a small amount of patients from the Mackenzie Richmond Hill site will be transferred. The next round of patients to make the move will start February the 9th, as determined by a GTA command table.
So what does that process look like in being able to determine which of those patients will be coming to your facility?
Right. So the command center has a view of what's happening in the province in terms of which hospitals are in need of relief. When they identify which hospitals are in need of relief, they issue what's called a directive, and that directive essentially says, Mackenzie Health, you're going to transfer one patient, two patients, whatever number of patients that is, to another facility. As we foresee in the future, we will be getting the directive to receive patients. And so once that occurs, we would then be in contact with the hospital that would be transferring patients to us to negotiate what that transfer would look like.
What's not clear is the so-called magic number, when the province will decide that COVID case counts and hospital capacities are under control and the Cortellucci Hospital can operate as originally envisioned.
And those conversations will continue with the province on when the Cortellucci Hospital can expand beyond COVID response in their massive 1.2 million square foot facility. Meantime, the Ford government says they will invest $18 billion over the next decade to build new hospitals across Ontario. For Breakfast Television and City News, I'm Melanie Ng.